What's going on, everybody? This is Jerome Moore, host and creator of Deep Dish Conversations. And firstly, I want to say thank you for all love and support, and thank you for exploring the perspectives of social change with me on this platform. I want to encourage you all to like, subscribe, and follow us on YouTube and on your favorite podcast listen platform. And make sure you give us a 5-star rating if you're loving the Deep Dish Conversations. I appreciate all of the support again. I hope you all enjoy this episode. Dr. Hildreth, how you doing? Welcome to the platform.
Thank you for having me. Happy to be here.
Happy to have you here. Congratulations. Nashville of the Year, Person of the Year. You know, they probably gave you Black Man of the Year. I don't know.
Well, I appreciate that very much.
I appreciate you. Want to give you your flowers while you're here and still alive with us and kicking and breathing and doing good work still. Appreciate you, your presence. Just from one black man to another, just thank you. And I hope more people, regardless how they feel about the pandemic and your work, just, appreciate your work and the impact that you're trying to have on just not the community of Nashville, but the world.
Thank you so much. I appreciate it.
Yeah. But I'm really interested in getting into your journey and your story. I had the pleasure to work with your wife on a few community organizing projects, community oversight boards, stuff like that. And so now I'm here. I want to get into all your secrets and all of those things with you. And so let's talk a little bit about just your upbringing. Camden, Arkansas. What's that like? What was that like growing up?
I had a great experience as a child. I was the youngest of 7 children. So I have 4 sisters and 2 brothers, and I was the youngest of the 7. And we lived on one of those streets where every mother on the street was everyone's mother kind of thing. And so it was a really tight circle, and I really enjoyed it. My father got sick when I was 10, and in January of 1968, he passed away, and I was 11. And I didn't really understand it. We have a hospital there in Ouachita County, and I didn't understand why my father could not get more help or care for his illness. So when he died, I was really puzzled and angry, and that was January of 1968. Then in April of 1968, on April the 4th, at 6:01 p.m. in Memphis, Tennessee, MLK was assassinated. He had become my superhero. So losing my dad, and then 4 months later using MLK, I was a pretty angry young man, and thankfully I grew up in a small town in Arkansas, because I lived in one of the big cities where all the things happened. Who knows what would have been my future? So I think that was part of God's plan, maybe.
Yeah, you grew up in a hard era for black folks. Not many opportunities, not just with people telling you can't do things, but just laws, right, telling you you're not allowed to do things.
Yes.
A lot of times when I talk with folks from that era, a lot of times they tell me, hey, we really didn't know because we was kids. Our parents kind of shielded us. We remember certain things from that. Was that the case, for you, or did you? How was that?
It was the case for me, because my mother is the one who I actually say prayed me through, because I was enraged, actually. I just couldn't believe these things that had happened, and my mother challenged me to do something about it. So I decided I become a doctor. But the problem is that in 1968 at the time, I had never seen a black doctor, didn't know if you could be a doctor if you were black. And I tell people that there are a lot of folks around me who were very discouraging, but my mother was not. And there's this group I love, Sweet Honey and the Rock, you probably know them. They had a song that goes, there are no mirrors in my Nana's house. So I didn't know that my hair was too nappy, my nose was too big, my lips were too thick to do the things. And so I think my mother took down the figurative mirrors, so I didn't know that I couldn't do these things.
Right.
Because she kept me focused, and that's really how it happened. I think that if I had had a different mother, perhaps I wouldn't have been able to make that journey, but thank goodness she got me through.
I was doing my research, and I read something about when you had decided that you wanted to be a doctor, and you had mentioned that at the time magazines would rank the top universities, and then that's how you came up with Harvard is where I want to go.
Right. I mean, I've always liked to read and study and make plans. So I went to the Washita County Library, and I read about doctors and medicine in medical school. And you're right, at the time, there were magazines that were doing rankings of schools based on your likelihood of getting into medical school if you're pre-med. And Harvard was head and shoulders above all the rest. Since I knew my chances were limited
Mm-hmm.
because of where I lived and the fact that I was black, I decided I got to go to Harvard. I mean, that's my best shot.
Right.
So I just made a decision at age 13 that that's what I was going to do, and I just stayed focused. I went to bed thinking about it. I got up thinking about it. It was my life's mission to get into Harvard.
At 13 years old.
Yes.
Now, Dr. Hildreth, now tell us now. At 13, 14, 15, 16, small town, you had to get a little bit of trouble. You had to.
No. In fact, my buddies all thought I was boring because, there was a time that I think we were in my mother's car, and one of my buddies, who remained nameless, took out a joint and wanted to smoke the joint, and I said, "Oh no, y'all not gonna mess up my plans."
Wow.
So,
You
yeah.
was that serious?
Oh yeah. Oh yes. There was nothing that was going to keep me from achieving that goal.
Wow. I don't know. Like that's like very high cognitive maturity.
Well, no, but I think the focus came from you have to understand how angry I was and how enraged I was at what had happened, and it took a lot to quench that, and that rage just turned into this amazing focus and drive that nothing was going to stop me. I mean, nothing was going to stop me.
You channeled that, and that was from your dad's passing and Martin Luther King's passing.
Yes, and my mother's great ability to take all those mirrors down.
Does that still drive you today, to this day?
Yes, and I tell people, it's like that big green guy from the Marvel movies, whatever his name is, the Hulk. He says, I think you have to make him angry for him to turn into
to transform.
And he actually reveals his secret that he's always angry. He just does it when he wants to. So I'm always angry. I've been angry I'm still angry about it. And when you watch what happened in the pandemic, a lot of organizations had an epiphany about the health disparities in our country.
Right.
When some of us have known that these things have existed for decades.
Right.
And it makes me angry that we keep saying we value our lives the same, but if you look at what happens in our country, it's clearly not the case.
Right. Harvard University. Me personally, I don't know. I don't think any black folks that I knew ever went to Harvard, felt like they could go to Harvard, and even living and being born and raised right here in Nashville, Tennessee, where we have, quote unquote, the Harvard of the South, as many of us has grown to know it at Vanderbilt University. But I didn't believe I could go there. I wasn't encouraged at my high school or by my guidance counselors, like, that's for you. And that was kind of the same sentiments from just local teenagers that we grew up here in North Nashville, specifically for me.
Right.
That school may not be for us. It's not welcoming for black folks or people that look like us. And so we chose different routes. Actually being able to attend Harvard, what was that culture shock? And
it was definitely a culture shock. But I also point out that there are some teachers, all of whom were white, thought that I was, living out a fantasy and that I should go to vocational school and be content with that. Be a carpenter, plumber, electrician, or whatever. But I had a couple of teachers, but always my mother in my corner telling me that if you stay focused and you work hard and you keep your belief in God strong, which has been a big part of my journey, the faith piece. Of course, I got there, and I'm this poor black kid from Camden, Arkansas. You got all these folks who've gone to boarding schools and had their own, bank accounts and funds they could draw on, and I just stayed focused. I went there for a reason, to get into medical school. I was not trying to become an elitist. So I wasn't trying to become what Harvard was. I was trying to get from Harvard what I needed to achieve my life journey. And so, but a lot of people were caught up in the fact of being at Harvard and being at this elite institution. That wasn't me. I had a singular goal.
Right. what were some of the navigational tactics that you had to acquire, adapt in that space?
Well, I think the thing that many of us did, because keep in mind this is in 1975, and
Right.
there weren't many black students at Harvard, so we kind of formed our own support group. And I was in Harvard had a system of, they called them houses, but they were actually dorms where the kids lived, students lived. So we were in Leverett Hall, and so all the black students in Leverett, formed a group, and we ate lunch together, we ate dinner together, we had parties and all that. So we kind of formed our own support group, and many of them had the same stories I did. They come from places that had never sent black kids to Harvard before,
Right.
and I think that's something I've carried with me, that there's always going to be people who can relate to your story, your mission, and we just have to support each other, which is
Right.
what we did.
What were some of the challenges that you faced on just initially being there?
Well, the first challenge I faced was a huge case of the imposter syndrome. I have to just admit it, that it's very intimidating to be at a place where you're surrounded by students, kids who've gone to, prestigious schools to get there. Their families are well known. I think when we were there, the daughter of the ambassador to the UN was there. There's some other famous politicians that had kids there. So it was intimidating. But my first powerful impression was when I walked into Harvard Yard for the first time, and I wasn't focused on anything but this huge building, Widener Library. At the time, it was the largest collection of books in the world.
Wow.
And I just stood there marveling at this huge building with millions of books inside and loving to read as I did. I just was just caught up in the wonder of it all. Can you imagine that here's a place with just hundreds of thousands, millions of books, and it's right there in front of me? It's hard to believe.
And so you studied chemistry.
Yes.
How difficult was that at Harvard University?
No, well, I started out in biology. When I took my first chemistry course, I fell in love with it, and it just seemed almost instinctive to me that once you understood how the electrons and protons moved in relation to each other, it wasn't hard at all. Conceptually, it's just a beautiful, because there's math involved, there's physics, but once you understood the concepts,
Right.
and you could apply the concepts, it almost became intuitive to me. So I loved chemistry, still do.
And so you graduated from Harvard, magna cum laude in chemistry. That was 79?
Yes.
79. And this is still, a very unique era in time.
Yes.
Black Panthers are not too far behind that
That's
in the
right.
70s.
That's right.
And so you transitioned into Oxford University, right, in England. Was this your first time abroad?
Yes, of course.
Um,
I'd never been out of the country before.
First time getting a passport?
Yes.
All of those
All
things.
those things.
All those things.
Yes.
How was that experience and journey in England?
Well, people may not know this, but Phyllis and I, my wife Phyllis, we met at Harvard. And the year that we graduated, I believe, there's a huge racial strife happening all over the country, but in Boston in particular. And I still remember there's a Pulitzer Prize winning photograph that was on the front of the Boston Globe of this black attorney coming out of the downtown center. He's obviously wearing a very expensive suit with a very expensive briefcase. And he's crouching down, holding the briefcase over his head because 3 white teenage boys had literally lifted the flagpole out of its stand and were about to pummel him with it, and the flag is waving. So the American flag is waving on this pole that's about to hit this black man who's walking out of, and he's the epitome of success. He's a very successful attorney walking out of the building, and these 3 teenage white boys are about to beat him with the American flag. It sort of captured the whole experience for us. And then when we got to England, England was in a recession. So it didn't matter what country you came from. If your skin was brown or black, you were not received very well. So as long as we were on the Oxford campus, things were fine. But as soon as we left the campus, go out into into the city proper, into London, it was not very pleasant. So I tell people, I mean, I grew up in the South in the 50s and 60s, and things happened to me in Boston and Oxford that never happened to me
Really?
in the Deep South in Arkansas. Yeah, I mean, it was sort of ironic and unexpected, but it was actually true that some of the things I experienced as a college student and graduate student in Boston and Oxford were very unpleasant.
Was there any time while you was experiencing these things you was like, I don't know if I can do this, or
No, it just made me more determined that I was going to finish the journey I started to witness the ignorance and the hate and all that. Um, and I still remember when I got the Rhodes, I was a Rhodes Scholar, so when I got the Rhodes, some of my colleagues and even a couple of my mentors suggested that I should turn down the Rhodes to make a statement about the prejudice and the hate because Cecil Rhodes had made his money by exploiting black laborers in his diamond mines. So they thought I should make a statement by turning down the Rhodes Scholarship to make that. And I thought to myself, what better thing for me to do than to have this man turn over in his grave that a black man should get his money because his will specified
right?
white students from English-speaking countries. So,
Wow.
yeah, so I thought I'm not going to turn it down. In fact, I'm going to take it and do all I can with it because of who it was
Right.
that made it possible.
And I kind of want to pivot a little bit because you're heating up, and I want to go ahead and just jump into it because I think it's crucial. I think for many people to understand, but I'm curious too. You know, was your during this time and the decisions that you was making, was your blackness ever questioned by peers or others? In
Of
what
course. Of
and
course.
how did you handle that? Because
course.
what we find, and I want to dig in this too, especially around the pandemic, is when we have people of color, specifically black folks in positions, high positions, positions of power, it's that double consciousness thing. And we hold, our black leaders, whether they're politicians, whether they're doctors, whether they're lawyers, any kind of high status of society, we hold them at a higher count, and we hard on them. So how did you navigate that?
Well, I mean, clearly someone with my credentials is not typically black like me. Harvard, Oxford, Rhodes Scholar, Johns Hopkins Medical School. That's not you wouldn't expect that person to stand up and you see that they're black.
Right.
So it's been many times I've been introduced prior to the internet age. I'd go to a meeting and they would introduce me and I would get up as the person they're introducing and some people would look at me funny, like, really?
Right.
So, and then there are others in my own community who believe me to be, that going to the places I've gone, they would express to me surprise at being as humble as I am. And I have to let them know a little secret. We get back to that big green guy again. That my humbleness is actually the ultimate form of arrogance.
Right.
I tell people this all the time because when you know that God has a plan for your life, you don't need to be out front with all that stuff. And I don't have to do that because I know that the good Lord has made it possible for me to do things I do. So that's why this faith piece is so important. And I let people know I didn't go to those places to become what they are.
Right.
Or what they symbolize.
Right.
I did all those things to get me ready to do what I'm doing.
Right.
And when I see people of color sitting at certain tables and rejecting or not focusing on the fact that they are persons of color, it makes me a little bit angry. I've never run away from the fact of who I am.
Right.
I'm a black man living in the United States, and that means certain things.
Right.
And I make people nervous because I talk about racism openly. Racism is not theoretical.
Right.
Racism is real.
Right.
And it doesn't matter what domain you look in, whether it's business, law, politics, education, medicine, across the board, there are structures in place that disadvantage me because of my black skin.
Right. In that medical space specifically, how did that show up? Whether it's, peers, whether you as a student, graduate student, in medicine school or as you became a professional and finished, how did that discrimination or microaggressions kind of show up in the workspace or in just in the space of medicine for you?
Well, well, there are a lot of examples. I mean, I could give. When I was a medical student, they would pair us up for the rotations with the attending. So we'd have two students and an attending physician, and we'd make the rounds and learn from the patients. And there are two incidents that stand out in my head. One is we walk into a patient's room, and this 20-something-year-old medical student, not even a doctor, starts addressing this 92-year-old patient, black man, by his first name. I said, oh, no. I actually said it. You don't know this man.
Right.
Okay. You should be calling him Mr. Johnson.
Right.
Right? And both the attending and the other medical student, who were both white, took umbrage with the fact that I'm pointing out that this man deserves to be treated with dignity and respect. Right. And then there was another instance where I'm paired up with a white medical student. This time happens to be a woman. And we go and we, talk to the patient. We come out, and as if I'm not even there.
Right.
I mean, this attending is focusing all of his attention and the teaching to the student. And I just interrupt him to say, well, I pay my tuition too. I want to learn as well. And again, they didn't, he took offense to the fact that I'm pointing out that I'm here.
You exist.
I exist.
Right.
Okay, you can't just ignore me, right? And so, I got written up a couple of times because I would actually speak my mind. But it's, again, there's things that happen that make that anger, it's always there.
Right.
It's never going away.
Right.
But sometimes things happen that make me want to tap into it and let people know that things are not acceptable.
Right. That's a lot to bear for one person. Who is that person or that community that you can go to that could understand your journey, what you was dealing with, and kind of prevent you from turning into the actual Hulk, right? Instead of keeping it in and just
Well, I think one person for sure who contributed that was my wife Phyllis, because we met at Harvard. We've been married for 42 years, so she'd sometimes be the one who would have to, help me to
right.
to have a different approach. Although my wife, as you know, when she needs to, she will.
Yeah, she can get
she'll
fired
bring,
up
she'll,
too, yeah.
she'll bring it, right? So, but I also think being the father of two amazing children helped as well, because I have to keep them in mind and make sure that they're going to be healthy and well. But until she died, my mother was clearly a wonderful resource. She never made it past the 8th grade, but she was brilliant and wise.
That's amazing how a lot of, like, for example, like my grandparents have similar stories, and their parents, like, not much education, formal education, but was able to instill a lot of powerful things that allowed their kids, the next generation, to go further and beyond and to the next level.
Right.
And it's just the resilience, right, of people, but especially of our black community that we've had to have here in the United States. It's one of a kind.
And that's what I tell my students and young people, that and even for myself, I recognize that some of the opportunities I have are not because I'm so smart or because of anything that I've done. There are probably hundreds of people, thousands of people whose names we'll never know, whose stories we'll never know, but their sacrifices made it possible for certain doors to be open, and I never take that for granted.
Right.
I tell people that my brother Charles, who's 10 years older than me, is the real bright one, smart one in our family, but he would not have the opportunities I had because he was born too soon. So I never take anything for granted.
Wow. You're navigating all these things, doing all these great things, in your profession, counteracting all the negative energy that's coming your way, and still figuring out the way to, stay focused, reach your goal. What was, I guess, your actual end goal for your profession at that time? You said, "Hey, this is the point I want to make it at, and this is kind of how I want to leverage and use all my experiences and my credentials to do this."
So, as I pointed out earlier, my motivation for doing what I was doing was my father dying when I was 11.
Mm-hmm.
So, my actual goal was to go off to these places, get my medical degree, get my training, come back to Arkansas. What I really wanted to do was to establish some medical centers in Arkansas. At the time of my father's death, I think there's 75 counties in Arkansas. 90% of the doctors were found in two places, Hot Springs and Little Rock. If you lived outside of those places, the number of doctors was few and far between. So my idea was to shift the distribution of doctors to make that more equitable. So that was really my goal. But another Rhodes Scholar, who was 10 years my senior, Bill Clinton, got elected governor. And to be quite honest, he actually changed the profile of healthcare in the state of Arkansas, which didn't give me an out, but it certainly changed my perspective. And when I got to Oxford and did my PhD in immunology, my goal was to come back and become a transplant surgeon, because the goal of transplant surgeons is to transplant an organ and not have the immune system reject it. So immunology owes a lot to people studying transplant for major discoveries. But when I did my first clinical rotation as a medical student, if not the first, one of my first patients was a black woman in her early 20s. She'd given birth to a baby, and both of them had HIV, and there was nothing we could do for them except treat the symptoms and watch them die. So after thinking about it and talking about it, I changed my plans from transplant surgery to focusing on HIV, and that's what I did. So, and I tell people all the time that one of the things that I've given myself permission to do is to follow the passions I have.
Right.
Because if you do that, and I tell my students and young people that all the time, because you don't want a good job or a good career, you want a great life. And when you follow your passions, that's exactly what will happen. You'll just have a great life.
I was reading some of your research and stuff about HIV, along with the pandemic, right, and how similar in a way politically
Yes.
they kind of were, right? And you said something that just before my time, I was just too young to really understand this, but you said because HIV affected like white men mostly, that Ronald Reagan waited 5 or 6 years to
Sure.
even announce that there was an issue,
Right.
right? And it could have been the same thing with the pandemic,
Yes.
right? On how former President Trump
Yes.
delayed and waited, right? And this is a quick backstory about me, Dr. Hildreth. I came back. I was living in China,
Okay.
and I came back 2019 October. I've been there for 2 years. I was living in Xiamen, China, and so just a few months before December,
Right.
and then we heard about it. Okay, we got this pandemic,
Yeah.
this virus is happening, and in Wuhan. And then only a few months later,
Exactly.
and I thought, oh man, I dodged it
You
just in
did.
time, right?
Yes.
And March 2020,
Yes.
it caught up with us here in the United States.
Yes.
But that was interesting that you made those two kind of.
Well, but I've had the misfortune of having to live through two pandemics. Actually, there are three pandemics. If you put in tuberculosis, I think in some ways it's still a pandemic. But in 1981, in the summer of 1981, there's all these reports in New York and the West Coast of young men who all happen to be white and gay getting diseases that indicated their immune systems were failing. And we knew we had a big problem on our hand. It turned out to be a virus. Well, because of the social construct of the time of homosexuality not being viewed as anything other than sin, the politicians thought, well, we don't have to worry about this because it's gay men, and who cares about gay men? They're sinning. So you're right that it took 6 years for Ronald Reagan to acknowledge that HIV was a problem. And as you know, for number 45, went on saying complete nonsense and untruths about COVID-19, even after, I think there had been 5 million cases and lots of people had died before he finally started telling the truth about it. So those are two striking parallels that illustrate how important it is for leadership to not let social constructs or prejudice get in the way of responding to a public health crisis.
Right. And I'm really curious, I want to get more into like the pandemic here in Nashville, right? And your role and your leadership into that, being at Meharry. Black folks have a very unique experiences with vaccinations and those sorts of things here in the United States. And we're kind of weary of it. Like, I don't know if I want to be getting a shot, because of like what happened at Tuskegee and these other things.
Yes.
And what do they put me into? And then so you get all of these. Social media is here too.
Yes.
And so everybody's an expert. Everybody's a Dr. Hildreth at this point, right?
That's right.
And we have the right to caution, but at what point, right, do we say, okay, what's going on here? And you're in a very peculiar, position because you're a black man, and right, and so you already know what's going to come with it, right?
Yes.
Regardless of all your credentials and studies, you know what's going to come with it, right? You're going to have some people that saying, okay,
right,
we need to get the shot,
right.
Why is he supporting this vaccination? He's a black man. He said no, right? And so when all of this was happening, right, what was your initial approach when you knew? Like, 'cause I'm pretty sure you understood this already, right? And so what was your initial kind of thinking and like how you was going to tackle this community-wide?
Well, the first thing is I thought the WHO declared it a pandemic 2 months too late. In fact, I remember sending a tweet about that life is about to change in a way no one's ever seen before, and we should get ready for it. And I did that in January when it took WHO until March to declare it. But, having been studying viruses since I was a junior in college, I kind of knew what we were going to be up against. But as a black man who knew a little bit about medical history, I knew there's going to be a problem because it's not just Tuskegee. It's involuntary sterilization of black and brown women. And I tell people, if you read the history and study the reports, it goes all the way back to 1619. It's been happening. Things have been done to black bodies in the service of research and medicine for 400 years.
Right.
So I knew we had to first accept that people have a legitimate reason for being a little bit mistrustful of medical research.
Right.
So I started there by saying, yes, you should be. And then I try to explain to them how this is different, how one of the scientists who discovered mRNA vaccines, or at least the technology to make it possible, is a brilliant black woman, Dr. Kizzy Corbett, who's now at Harvard on the faculty, that there's something called a Data Safety Monitoring Board. These are independent observers who get to watch the trials and see the data. They're the only ones who know who got what, the vaccine versus the placebo. They have the power to stop the trial if they think that the safety's been compromised. Persons of color were part of all those data safety monitoring boards. Then finally, when the trials are over and the data goes to the FDA convenes a panel of independent scientists to review the data, to make recommendations. I'm on that panel, and one of my colleagues, Dr. Fuller from the University of Michigan, who's a black woman, she's on that panel. So I try to just have people understand how this is different, but to acknowledge there is reason to be mistrustful, but to try to give them a perspective that this is different.
Right. It was certain instances where you were called out, via social media,
Sure.
by black folks.
Sure, of course.
Right. How did you take that?
Well, I took it for what it was, and I think that when people don't know you and your story and all that you've lived through, you just have to say, well, it's not going to stop me from doing what I know I need to do.
Right.
I could not live with myself, and I cannot unknow what I know.
Right.
And for me to not say the things that I've said and to do the things I've done, I don't think that box would have been checked when I'm standing at the gates. So I'm going to do what I got to do.
Right. This also led to you being appointed by President Biden, right, on the COVID-19 Health Equity Task Force.
Yes.
What did that mean? What did that mean for you and for those who just don't know what happens on that task force?
So I think the task force was formed to acknowledge that in our country, there's a chasm in the health status of black and brown people and white people, and that the pandemic revealed this in a way that few things could. Because if you had underlying conditions, you're more likely to get really sick and they're more likely to die. And what does that mean? That means that minority communities.
Right.
So President Biden took the initiative of appointing a group of individuals across a spectrum of backgrounds to review what is happening and make recommendations for change. So I felt that as a scientist who understands viruses and what the pandemic was doing because of the virus, as someone who's devoted my whole life to focusing on trying to make sure there's equitable access to medical research and healthcare and all that for black folks, I mean, I thought I had something to contribute, so I was happy to be a part of it. You know, but there are people on there representing incarcerated individuals, people representing handicapped individuals. So I think I learned a lot from my colleagues, and to me that was a great part of this, is just learning from other people and hearing their perspectives.
Equability, right? We hearing that a lot. We want a just and equitable community, world, right, city. What does that look like in the medical field and for just and equitable healthcare?
So, like with all the other domains of our lives, racism and bias is a big part of healthcare. People know this or should know it, that we've known for a long time that black and brown patients are not treated the same necessarily as white patients. In fact, there's research to show that if you take two model patients who are actors, you give them the same job, same income, same zip code, same everything, and you send them to a doctor, the white patient is much more likely to get the most aggressive treatment plan that gives the best outcomes than a black person, even though everything about them except their skin color is the same. We also know that algorithms are now being used to determine treatment plans. What happens is these large data sets are being used to develop algorithms that can predict outcomes, can recommend treatments, and even those algorithms are biased. Give you an example. There's an algorithm used in ICUs to determine who should be put on a ventilator. And one of the reasons why black patients often didn't end up on a ventilator compared to white people in the same ICU unit was because the algorithm favored the white person or biased against the black person. I mean, people need to know this stuff.
Right.
That, and then when it comes to acceptance in the medical school, I believe that we have a problem that when I enrolled in medical school, I think there were about 550 black males who matriculated that year, who entered medical school that year, in new classes. If you fast forward 30 years to, 2012 or 2015, whatever year it was, that number had actually dropped to 512, even though when I started medical school, there were 120 medical schools. There were 20 additional medical schools by this time, thousands of additional seats. So white women, white men, Asian women, and black women all gone up, but black men went down. And part of it is the pipeline, but part of it is also implicit bias against black males, as you well know.
Right.
So healthcare is not different from any other domain in American society where bias is playing a role, both in interactions between patients and physicians, but also in who gets to become physicians in the first place.
It's interesting you say that, because being somebody in community for a long time, community development domestically and abroad, you hear about like hunger, you hear about housing, you hear about policing, you hear about education. Medical healthcare tends to not get that same type of light shined on it, not until the pandemic happened. Right?
Exactly.
And then we was like, oh my gosh, right? what can we do? What can community do? What can, civic leaders do to make sure healthcare is equitable healthcare is addressed, and just I don't know, does that happen in medical schools? That's something that's talked about in the classrooms as well. Um, Implicit bias trainings with doctors, like how do we try to correct some of these systemic
I
things?
I think that the general public just need to be made aware of just how pervasive this phenomenon is of bias and racism interact. Now healthcare only accounts for about 10 to 15% of our overall health.
Right.
Those social determinants of health that we've read about and heard about count for the rest. Where you live, where you work, how much money you make, what schools you go to, what schools you can send your kids to, and then finally having access to health care. But if you probe deeply enough in all those areas, racism and bias will raise its head as a factor. So, but I think we have to make sure we're holding leaders accountable, that when decisions are made and policies are made, the question should be asked, can this be executed in a way that's fair to all of us?
Right.
That is not going to bias one group against another.
And how does your role and your position now play a part in making sure that happens?
Well, I think that being the leader of the largest, oldest, independent academic health science center in the country gives me a platform to keep this problem in the forefront of leaders of national organizations and elected leaders. So I'm trying to do that. But at the end of the day, we as voters and taxpayers have to hold leadership accountable for policies and things that are equitable.
Right.
But as you watch what happens around the country, it seems that hate is driving some of the decisions being made.
Right.
Where laws are being passed that would seem ostensibly, at least, to reflect a strong bias against certain members of our population. And to me, that's unacceptable. And we just have to start making it known by who we vote for that that's unacceptable.
Do you do you get any pushback to, Dr. Hendricks? Maybe you shouldn't, maybe you should stay neutral in this, or maybe.
Yes, I do. I mean, my team members are often nervous about some of the things I put in social media, but at the end of the day, if I don't speak my truth, and if I think my truth can be impactful in making things better for people, I just feel I have to do that. And I'm speaking my truth. I'm not speaking anybody else's truth.
Right.
Right. And so I think I'm entitled to do that. I think I've earned the right to speak my truth, and so I'm going to keep doing that.
What do you feel is next for, our community here in Nashville, the state of Tennessee, the United States when it comes to this pandemic? Is it just going to be a part of our social fabric going forward?
Oh, yes.
Is it,
Yes. I think coronaviruses are going to be with us for some time to come. And what happens next all depends on when and if a new variant occurs that the vaccines we currently have do not work well against. And there's already indications from Israel, for example, where they've given a fourth shot of the mRNA vaccines. And there's an improvement, but it's not as significant. In fact, it's no better than the flu vaccine. So what that tells me is that we probably come to a point where new and better vaccines are needed. Now, thank goodness that these vaccines were available to us as quickly as they were, because God only knows what will happen without those vaccines.
Right.
But I think viruses, especially RNA viruses like the ones we're dealing with, have built into their biology to mutate and become different and get better at doing what they do, which is to infect us and be transmitted from one person to another.
Right.
So it's no surprise that SARS-CoV-2 is doing that. So I think that at a minimum, the viruses are going to become endemic, and what that means is there'll be local outbreaks in different places. And as long as we respond quickly to those outbreaks, and I think the drugs, especially the one from Pfizer, that's 90+% effective, if those can be given quickly to those who test positive, I think we'll be able to control this. But if a variant arises that the vaccines do not cover, then all bets are off because we might find ourselves back in the kinds of situation we were in back in 2020.
For community members that have got the vaccines, have got the boosters, and it's been boosted as much as they can be boosted at this point, and still happen to catch the virus, and now have different questions or community because the information is just coming in so rapidly, and everybody
Yes.
is not doctors. Everybody don't
Right.
can't understand the verbiage sometimes that is being used. What are some resources? What are some places community can go to kind of get simplified but also accurate information to help them make a healthy and the best decision they need to make for themselves or their family, or just be aware of what's just happening and changing on a daily, weekly, monthly basis?
Well, I, with a couple of caveats, I think the CDC is still a reasonable source of information that is helpful. Even the local health department, I think Metro Health Department has done a great job of staying up to date on what is happening, and I think their website is a good one. But I would also recommend for those who really want to know what's happening in the grand scheme of things, the WHO website for COVID-19 is excellent. It tells you where things are happening, what the new variants are. It has updates on vaccines, because there are actually 20 plus vaccines now being used around the world. So
Wow.
mRNA vaccines are not the only ones. And so I think the WHO website is really, really good. And, so I think those are some places that people can look to get information. And also the Meharry website for COVID-19 has some good information for people who want it. So I think, those are good sources. But thankfully, if you've been vaccinated and boosted, and if you get infected, it's very likely that you're going to be asymptomatic or have very mild symptoms. So the vaccines are doing what we need them to do, which allows me to make the point, vaccines do not create a force field around us to keep the virus out of our bodies. What they do is they make sure our body can respond effectively to deal with the virus once it does get into our system.
And so, what's next for the Nashvilleian of the year? For the person of the year, what's next for you in just professionally, kind of how things are
Well,
going on? Is that Meharry, community wide?
well, I'm excited about what we're doing at Meharry. We've started some new programs. We have a new school of applied computational sciences. We started that because I believe that data, understanding data, having facility with data is going to be important for success in the future. So we're going to train up some black and brown biomedical data scientists who can actually help us make sure algorithms are not biased, do other things. We're hopeful to be starting a physician assistant program pretty soon. We've had our site visit for accreditation. We're waiting to see what the results are. We're feeling pretty good about that. And we're also planning in the planning phase for starting a school of public health.
Okay.
Because what the pandemic also revealed was the public health system in our country is fragmented, ineffective, poorly resourced, and we need to start training individuals who can be embedded in communities to drive the health of those communities from within. And that's going to be one of the focuses of our school when we launch our new School of Public Health. So I'm excited about Meharry. We have the best students, I believe, in the country. They make us proud every day. I love relating to people that we take students that more well-known medical schools reject, and by the time we're done with them, those same schools are recruiting our students as residents, which speaks to how hard my faculty work to get them ready, but also the quality of the students that we attract. So I'm just thrilled to be Meharry's chief cheerleader. I'm very excited about the future.
Well, Dr. Hildreth, I really appreciated this time that you gave me for being here and from your busy day. And I want to give you the last word. Is there anything that our viewers and listeners, and we're talking directly, to the Nashville community here, should just be aware of that maybe some of my questions didn't get to today?
Oh, well, I think that one of the things I'd like to share with people is that if we don't do something soon, the polarization in our country is going to have a very bad outcome. We've come to a point where difficult conversations about difficult things are necessary, about race, about the changing climate. Climate change is real, I mean, for God's sakes.
Right.
And also about accepting people for who they are. This whole thing about having bias against people who are different for whatever reason. We just seem to be looking for ways to hate each other. And I just think the time has come to have some really challenging, open conversations if we're going to move forward together as a country. And I hope people will consider that and do that. I mean, we have a habit, and I know I'm guilty of it sometimes, of seeking out information that reinforce our own beliefs.
Right.
We've got to take some time to maybe listen to some sources and people who might have a different opinion than ours, and have a way to find out what we share in common and find a way to move forward together. So I think the time has come for that. It's desperately needed.
Well, and that's why this platform is here, to create a brave space to be able to have those conversations that can be very tense. But tense can be healthy. You can be a healthy tense, right?
Yes.
And hopefully, that's what is achieved here. And hopefully this conversation that we had can start other brave and healthy tense conversations in other communities outside of Nashville, but definitely here. And see what health justice look like.
Yes.
All of those things, right? And take a deeper dive into it. So I appreciate you being open and sharing your journey. And I'm pretty sure people learned something about you that they didn't know.
Wow.
And just got into and learned about your perspectives of things, right? And so I really appreciate that, Dr. Hildreth.
Thank you for having me. I really appreciate it. And thank you for the work you're doing.
Oh, no, I couldn't, hey, I'm learning. I'm always growing and learning, and I try to learn and take away something from every guest that I have. So thank you.
Thank you.
All right, until next time.